Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 105,536 confirmed cases of COVID-19 in Canada and 35,794 cases in Ontario. Chatham-Kent has 158 cases and Sarnia-Lambton has reported 286 cases. Michigan now has 65,876 cases, with 11,709 cases being in Detroit. Today, we are reporting 1,672 cases of COVID-19 in our community, an increase of 7 cases from yesterday. 4 are community cases and 3 are still under investigation. 998 cases have now resolved. 565 people are self-isolating. 25% of our cases are between the ages of 20 and 29 years. 23% are between the ages of 30 and 39, and 17% are between the ages of 40 and 49 years. 63% are male, and 36% are female. 1% is unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care homes experiencing a COVID-19 outbreak, and there are currently 4 workplaces in the agricultural sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing or are struggling to breathe or speak, or you are experiencing severe chest pain, feeling confused, or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechew.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for further updates.
Good morning, everyone. Thank you for joining us again. Over the weekend, the Windsor-Essex County Health Unit reported an additional workplace outbreak in the manufacturing sector. As businesses and workplaces begin to reopen across the province and in our communities, employers and individuals must continue to work diligently to ensure that all appropriate health and safety measures are in place. These measures include in-person screening employees daily for symptoms of COVID-19, changing the workplace to ensure physical distancing of employees, staggering break, lunch, and start time, and health and safety training and proper use of personal protective equipment where appropriate. It is very important at this time to ensure that all of these practices are in place to prevent your employees getting infected by COVID-19, or if they are infected, potentially passing it on to other people. Early in the June, Ministry of Health provided guidance to all public health units for identifying and managing workplace outbreaks. The role of public health unit in a workplace outbreak is to receive and investigate report of cases and contacts, investigate clusters of cases associated with workplace settings, and determine if an outbreak exists and provide guidance and recommendation to the workplace on appropriate outbreak measures. In addition, issue any order under the Health Promotion and Protection Act if necessary. We also are supposed to facilitate outbreak testing and establish when the outbreak is over. The goal of detecting and investigating any outbreak in the workplace is to identify and address any potential health and safety concerns and stop the transmission of COVID-19. Generally speaking, a workplace outbreak will be declared when there are 2 or more confirmed cases of COVID-19 in the workplace where there is an epidemiological link. And by epidemiological link, we try to link cases with each other either through close contacts in time, place, and person. If all of those things are combined together, it gives us some epidemiological link. We also are interested in the place perspective to ensure that all of those transmissions are happening at the workplace. The action and role of the public health unit is also dependent on the size of the outbreak and the results of any ongoing investigation of the cases and also at the workplace. In any workplace outbreak, key partners include the Ministry of Labor, the employer, the Internal Health and Safety Committee of the workplace. Collectively, they all assess existing prevention measures in the workplace, including engineering controls such as modification such as plexiglass barriers, workspaces, physical distancing, ensuring that there is enough space for all these people. In addition, there could be some administrative controls, which is by the virtue of having policies and practices in place, and also from a source control perspective, such as training and the use of appropriate personal protective equipment. Workplaces should visit the Ministry of Labor Training and Skills Development website for guidance specific to their sectors, as well as workplaces can find guidance documents, toolkit, and signages on the Health Unit, Windsor-Essex County Health Unit website dedicated to COVID-19 homepage for workplaces. The Health Unit answers question and response to complaints on a daily basis, and our team is out there investigating all these complaints and concerns and initiate any investigation as needed. As more open workplaces and more people interacting, the risks become greater for the transmission of COVID-19. It is important for the employers to do their part by ensuring all health and safety measures are in place and that employees and their residents continue to follow public health guidance and prevention measures, including washing your hands regularly and often with soap and water or alcohol-based hand sanitizer if soap and water is not available. Always maintaining a physical distancing of 2 meters from others, even with your colleagues, even at your workplace at all times. And if it's not possible, please wear an appropriate face covering in any area that you are. Cover your cough or sneeze is the most important, and stay home if you're sick. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Yes, Doctor, I'm just wondering, after Windsor and other regions have been in stage 2 for more than a week now, any big problems coming up, any really glaring issues that you're seeing in the community with the reopening?
So we have received a lot of, educational complaints on the workplaces, restaurants, bars, and patios, where our inspectors and the TVEOs has to go out and do some education. We have addressed many of the complaints regarding the use of mask or face covering. So we have attended to that, and as we are seeing some of these workplaces as well, I think it's important that we need to recognize that businesses are more open now. There are more businesses that people can go to. The likelihood of people coming in contact with others is increasing. So that is something that we all need to act on as the community and take our responsibility to ensure that, first of all, if you're sick, you're staying home, and always maintaining 2 meters physical distancing to limit the spread of the disease. I think it is important that we all understand that, and we all take a good, strong measures to ensure that this is not happening. And we will be keeping a close eye on all of these workplaces, and will provide appropriate guidance. But we're all in this together. I think the community has done an excellent job in reducing the community spread. So it is about time that we need to shift our attention that this is the new risk right now, and do not let our guard down. It is just we need to stay in the same stage or move forward to the next stage. So it is important that we all play our part in it.
And we still have had a number of community cases over the last week or so. I'm wondering if you can comment, obviously not specifically, but where generally are people contracting it in the community? Are you able to figure out where they're getting it? Are people telling you, oh, I just went to the grocery store and I must have got sick there? Or what are you hearing?
So we're hearing all sort of questions. So I think that's we're trying to proactively assess any potential link and exposure to a workplace or any settings to identify if there's any cluster that's happening. But we are getting I guess information from every settings, mostly people who are meeting others and people who are going to the workplaces, and we're just trying to link it back to see if there's any connection. So right now, all I can say is it's spread pretty much everywhere, and not one particular risk area that we can say that it's identified.
Thank you.
Any questions from CTV?
Yes, good morning, Doc. How are you today?
I'm good, Bob.
Awesome, miss you guys. Just curious, how many educational opportunities have you had? Just to follow up on the start there.
Since the beginning, my team is telling me it's hundreds. So there's a lot of opportunity for education, and I think the media can do a good job in identifying those risks and expressing those things. That we're in stage 2. The pandemic is not over yet. The COVID-19 hasn't gone anywhere. So I think we still need to recognize that and do our part. And I can understand that people may be doing this all this following for too long, and they may feel that it has been lingered on for quite some time. But please be mindful that it's not over and it is still there. Any wrong moves or any I guess inaction on our part could lead to more cases. So please be careful when you're out there and do your part.
Just to follow up on that, so just curious.
Before you follow up,
I know
Bob,
I asked you this.
Sorry, Bob.
There's always follow up.
So Teresa wants to comment, then you can follow up.
I was just
Yeah, definitely. Okay, yeah.
I was just going to give you a number. Since June 30th, our TVEOs, the Tobacco and Vaping Enforcement Officers, have followed up with about 220 complaints. So that just puts it in, gives you some more context.
Okay, that's awesome. Thanks, Teresa. So I guess that leads to my next question. I know I asked you this before I went on vacation last week, but what is your threshold? You know, like the educational thing can only last for so long. So do you guys have a threshold as to when you'll just say, okay, now we have to start finding people?
Yeah, of course. I think if it's a first thing, obviously we try to educate, because a lot of the time that it's not that the workplace or the business owner do not want to do this. I think sometimes it's just their lack of understanding. So we try our best to do that education part, but repeat education and still see the same violation, that would definitely result in fining. And but we are hoping that with good education and the tools available, we won't end up in issuing a fine, but we will if it's needed.
Okay, and just a sidebar, heat wave. We're going to be in this pretty intense heat wave for the next few days. So, any thoughts on that?
Moving forward?
Yeah, I think that's we issue our heat advisory regularly based on the forecast, and provide our messaging for people to stay indoors and wear light colored clothing, and the time of the day when people can go out. And I'm also aware that there's a special advisory coming out this morning from Environment Canada about the poor air quality that we can expect given the high humidity and temperature. So people who have any type of chronic illness, any respiratory or heart condition, they should be taking precautions, and people need to be well hydrated and stay in the shades as much as possible.
All right. Thank you, Doc. Thanks, Teresa.
Thank you.
Any questions from CBC?
Yes, good morning. Last week, the health unit issued an order to one of the farms to stop working. I was just wondering if there's an update on what's going on at that location now.
So the workers were removed from that farm who were identified as a case, or also identified as a close contact of the case. So all these workers are currently self-isolating away from others and there's a health team collaboration that's happening locally, and also the province coming down here to support all of these initiatives and to ensure that there's a smooth coordination that's happening and meeting any health needs of these people who are self-isolating, and also any other needs such as accommodation and food and other logistics that is needed. Over the weekend, we worked very closely with the farm owner and operator, along with the different levels of the ministry, to provide more support and guidance for them to ensure that they are able to maintain some of the work that we are doing, along with our partners from the Emergency Management Ontario, Red Cross, other levels of the ministries, Ontario Health, the local health hospitals, our local CEMCs, and also the municipalities. So we're all trying to support the entire agri-farm sector, and the lessons that we are learning from this particular farm will go on to support other farms as we move forward with the testing, which is already ongoing, and we hope that we'll try to provide more support and guidance to these farms.
Any indication on whether other employees at that farm are allowed to return to work?
Well, we did our investigation and identified all the high-risk people who needed to be off farm. So those people are off farm, and then recognizing that some of these farms have large operation and many of their sites are not even connected with each other from an employee perspective. So the people who are not connected with the farm per se, or any of the cases that we are looking at, they can work. And that's the intention, to give them some employees to maintain their operation as best as possible.
And last week, when we had a big surge of positive cases among members of the agri-farm sector, you said that many of them had reported being asymptomatic and that the health unit needed to investigate. Is there any updates there about how many may have been truly asymptomatic, or how many may have contracted the disease up to 3 months ago?
Well, it's putting a timeline would be a really hard one. So when we did our assessments, our team was out, I think at least 3 or 4 times over the last week, to do a health check on all of these people, initially on all the positives, to get a better handle on how many of them are truly asymptomatic. I believe we found less than 10 people at the initial assessment who were truly asymptomatic, and then later on, when we did a follow-up assessment, some of them the list was added a little bit with mild symptoms, not necessarily linked with COVID, but they had some symptoms which put us in a question mark to say whether they are suffering from COVID or not. So that was happened, and then the people that we took out who were identified as contact and initially negative and currently self-isolating, some of them are also showing some symptoms. So it's great that we took them out early and removed them from the rest of the group. So if they come back positive, at least the rest of the worker will be saved and will not develop the disease. So that's the hope and intention. And we will continue to follow up with all those people, and we'll take all the appropriate measures to prevent and limit the spread of COVID-19 in these workers, and ensure their safety and well-being by doing regular health checks on them to identify any health needs for them.
Thank you.
Any questions from Blackburn?
No, I'm okay, thanks.
Any questions from AM 800?
Dr. Ahmed, over the weekend, we reported that 2 Real Canadian Superstores had employees that tested positive. Loblaw, the parent company, confirmed it, said they were working with the local health unit. But in a letter to the employees, it says, today we learned that one of our colleagues in the Walker Road store has tested positive. In addition, Public Health has advised that an additional colleague from the same household is presumed positive. Would that mean the 2 employees work at the same store, and shouldn't that be considered an outbreak?
At this point, all I can say that any of these workplaces, we didn't find any connection that they are all those 2 separate, and there is no evidence of transmission at the workplace. But as I think many of the employers do, if they have a case, they proactively report and take appropriate measure. We work closely with them and support them in ensuring that if their worker, depending on the nature of their work and depending on what they're coming in contact with, we do that investigation and provide appropriate guidance. when we are talking about presumed positive, it's going back to the same idea of having a very close contact in the household that could potentially transmit it to anyone who's living in the household. So I think that's we need to know that when we are declaring any outbreak, in any workplace, the transmission is supposed to occur at the workplace in order to make that determination that the workplace is an outbreak, because the transmission could happen at somewhere else, and these two people may still be connected and go to two different workplaces. It doesn't mean that they are part of the outbreak. So that's some of the detailed investigation when we do and make our recommendations based on that.
Okay, and then the company also said they were working with the health unit when it comes to cleaning. So would the health unit go in after to make sure everything was properly cleaned? How does that work?
So typically we don't do that to ensure that they are cleaning appropriately. The cleaning instructions and guidance, we do provide that recommendations. If it's something that we are talking about, like a restaurant or where they serve food, and if there's any concerns, then our inspectors can go and do a follow-up on that. But just as a general workplace, it's not something we do regularly, but if needed, we can go out and to support them. But we provide them with all the tools and resources that they need to ensure the cleaning and of the workplace and identifying any potential employees who could be at risk.
Okay. And finally, when it comes to face masks, face coverings, shields, is there a preference for wait staff? I heard out and about over the weekend that some servers were asked to wear face coverings or masks instead of the shield. Is there a preference for the health unit for, I guess, servers or waiters, waitresses, hostess? Is there a preference for the health unit?
Well, if we are going back to the recommendation and the need for why we issued that recommendation is for the source control, and especially for someone who's wearing the mask, if they develop any symptoms, they are unable to pass it on to others. The face mask is the appropriate one because it covers the face, and anyone, if they're coughing or if they're talking loudly, some of these droplet particles that can come out of the mouth, it can easily be captured within the face mask or face covering. So that's the intention that we are trying to use, that this is what they need to use. A face shield can protect you, but it may not protect others, and also its face shield is generally are meant to protect your eyes. It may cover a part of your maybe your nose, maybe, and partly some of your mouth, but it doesn't necessarily cover or protect others, because they're still on the sides and from below the face shield, there are opportunity for these droplets to spread out. So the ideal recommendation that we have made from a public health science perspective is to wear a face mask as opposed to face shield.
Thank you.
Any questions from Windsor?
Good morning. Yeah, just to follow up on the 220 complaints, were those specifically related to masks, or enforcement of social distancing on patios or that kind of thing, or is it sort of like a mix of everything?
So I'll let Teresa answer that question.
It's been mostly masks, questions about masks or non-compliance with masks, and also patios, outdoor patios, and not socially distancing or that type of thing.
Okay. And among those 220 complaints, were there any repeat complaints in those?
I'm not sure, but I do know that there have been repeat complaints, but I don't know in that. I know we get calls from all sorts of sources about the same issue, so our staff will go out and investigate.
Okay, thank you.
Okay. Any further questions from the Windsor Star?
No, thank you.
CTV?
Just curious, Teresa, has there been any defiance by any of the business owners when it comes to the educational end of it, or they might be doing something that they feel is minor, but we got to take serious anyway? Has there been anything like that?
Not that I've heard of. Our staff are really good providing the education and the rationale, and I think there's been a lot of good information out there from the health unit about the public health measures and the reason to continue to be, to attend to these measures. But Not that I'm aware of that's been brought to our attention.
Okay, fair enough. Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thanks.
Amy Hendry?
No, thanks.
Windsor-Essex?
No, thanks.
Thank you, everyone.
Thank you.
Thank
Bye.
you.